you guys, it's your boy JV, and today I'm going to be talking to you guys about top surgery. Well, my experience getting top surgery. So, first things first, I got my top surgery March 29th of this year. I went to San Rafael. My surgeon name is Dr. Bellick. I'll tell you a little bit about Dr. Bellick. He's a good surgeon. He's really goofy. So when he did come in there and start talking to me, because he had to come in and draw on my chest, take measurements and stuff. So he did that, and he's just extra goofy, and it helped a lot because I was super nervous. I was scared. Excuse me. I had so many mixed feelings. It was just a lot going on, and so his team was great too. The women in there, they made me feel like I was at home. They very caring, very caring. Man, I like that a lot. So my biggest fear about surgery was me waking up to pain, or just being in a lot of pain. And that wasn't the case. I woke up, I wasn't in no pain. I was actually trying to wake up. I just remember somebody kept saying my name, and it's like, do you know where you are? And then I just go back out, and I come back in, and I know the second time, me kind of like trying to wake up, I just start laughing, just laughing for no reason. And in my head, I'm like, why are you laughing? But you know, the medicine just had me just extra goofy. So I went home that day. So you have to wear a binder, which I really did not like at all. I hate the binder so much. And that's like I said, I hate it. I don't know if you're gonna feel the same, or you might get a different binder, but I just didn't like it at all. So I couldn't shower for a week, like my chest or anything like that. I didn't like that either, because I like taking my showers. But so I couldn't shower for a week, and then a week later I got my bandages removed, and so it's taking off the bandages. Dr. Bellick wasn't in, so he had another surgeon remove them. He was cool. I don't remember his name, but he was cool. The nurse in there, she was talking to me, and she was just flirting with me the whole entire time. She just flirting with me, and I was just like, okay. I mean, she had an accent. Loved it. But I was like, okay, whatever. I don't being nice back, talking to her. So when you're moving my bandages, I'll show pictures. It's like these like things they put over your nipples. I don't know what they're called. But they stitch them on. So he had to cut the stitches and take them off. And I don't know, I guess I was just too nervous, or anxiety kicked in, or whatever. After he removed everything, I had to stand up and take a picture, so he could see or whatever. But when I stood up, I felt like I was gonna pass out. So I just, everything was going dark, and I had to lay back down. For one, I didn't eat that morning, so he was saying that could be a problem too. So I had to lay there for a minute. The nurse came back in talking to me when I was getting up. So she was super sweet. And then I left the hospital. I went home, and they said I could take a shower. But for me to be able to take a shower, I have to have the water running on my back. And that's because my nipples were still healing. And that's because the top surgery that I got, I didn't just get like the tissue and stuff removed. I also got nipple grafts, like my nipples replaced so my nipples can be smaller. And if I didn't, I could have just took a shower normally, like I could have faced the water and everything, but no, I had to let the water hit my back. And I had to take a shower like that for about, I want to say 2 weeks, just until my nipples got strong enough. I also show pictures of that too, because when you get when you have to let your nipples heal, they the skin that they put over it comes off, and I didn't know that. So you also have to clean it yourself too. So I'm cleaning it, and when I remove like my Band-Aids or my bandages after I clean it, the skin was like coming off, and I'm like freaking out. I'm like it's not gonna heal right. I'm panicking, and I'm just tripping out. I'm thinking like I'm just not gonna heal good. I'm gonna have to go back and or my nipples coming off. But I talked to my surgeon, and I also looked somebody up on YouTube too. They said it's perfectly normal. They said that's actually what you want. You want your skin to come off and for your nipples to be pink. That's them healing. And once they like get fully pink and there's no extra skin on it, or they're not bleeding or anything like that, stop covering them, stop cleaning them. Not stop cleaning them because you take a shower, but you make sure you put lotion on them. You got to keep them moisturized. So after I found that out, I was like, okay, good. But you know, as soon as you find out how things are supposed to heal, now my skin's taking forever to come off. So I'm like, here we go. So I gotta keep taking a shower. The water's hit my back, so like just the water can run down. They don't want too much of the pressure hitting your nipples. So another thing, don't be around smoke. Don't be around smoke, because your nipples won't heal right. They'll detach. Honestly, like that's what they told me. They said you don't want to be around smoke because your nipples can come off. And I know it sounds really funny, but it freaked me out. So every time like I see somebody smoking, I would like just dart out the room, or I'm bagging up. Like I'm gone. Like you won't see me at all, because I don't want my nipples to fall off. So anyway, where was I at? Instead of me talking about my nipples coming off, they're not off. Just to let y'all know, they're on. They're healing. So when I first cleaned them, I didn't pay attention to the Band-Aids that I got, and they were extra strength. So when I put them on, getting them off was the worst pain. It was the worst pain, because my incision, the sticky part was on that, and it was up here too. So that part wasn't as bad. It took some hair off, I ain't gonna lie. But when it got down here, I was ready to cry. So be careful of what you put on. I use after I got more comfortable cleaning them and using different things, I just use gauze, or I cut the Band-Aid just so I can use the padding part and put the the tape over it, and that was fine. It stayed on all night, and it was easy to come off. So I'll also post a video of me cleaning them, so you know you guys can see. So let me see. The binder, I had to wear my binder the entire time, the whole so was it 6 weeks, either 6 or 8 weeks, and that's because I didn't have tubes. He didn't use no drainage tubes. I'm so glad he didn't use those. So he didn't use those, so I didn't have to worry about that. So that's why I had to keep the binder on, because to keep from fluids filling up. So if fluids did get in there, he said that they were gonna put a needle to suck the fluids out. I heard that. I said, yep, this binder will stay on. No matter how much I hate it, I will keep it on. So, yeah, so the complications that I'm having right now, and I'm not saying that you guys will, just me personally, my stitches didn't dissolve all the way. So I'm also gonna post a picture of that too. There's a stitch coming out on my right side, and I finally seen it last night because I was wondering, like, I shouldn't be in pain still. I still shouldn't be in pain. So now I realize that there was actually a stitch, which my doctor was right, because I went to go see her, and she was like, 100%, I think there's a stitch still in there. Because she said some people, the stitches don't dissolve. And I'm one of those people. Lucky me. So that's been painful. And also my left nipple, it keeps swelling up. I don't know why, but I'm waiting for my surgeon to hit me back and to let me know what's going on. As soon as I find out, I'll let you guys know, just in case, hey, you guys go through it. My information can help you out. But right now, I'm just dealing with it until we figure out what's going on. But other than that, it is the best thing I could ever done for myself. Like, do you know how good it feels to go outside with your shirt off and let the wind just hit your back? It was the best feeling ever. Like, I'm being so honest with you guys. It's the best thing ever. So I'm gonna post pictures of 2 months, 3 months, so you guys can see. But I think I talked about everything, what I've been through. So I can actually show you guys an update right now, so you guys can see. I'm almost 3 months in. So this side, actually, see how this one's like really small, and then this one, because I was using my right side, so I didn't let it, basically I was doing stuff I wasn't supposed to do, so it kind of like pulled more on my right side and kind of like stretched it. So yeah, but yeah, right now we're just only 3 months in. Well, not 3 months, not yet. At the end of the month, I'll be 3 months. But also, taking a shower. When I was washing up, it was kind of hard, and really like the armpit area, because I barely like lift my arm up, and plus to try to like rinse it and try not to hit my nipples because they were still healing. It was a little difficult, but you're gonna go through a lot of things. Everybody heals differently. Everybody has different complications. Some people don't, and that's good. I mean, I hope you guys don't have any problems. But that's about it. That's like my only biggest issue, that my stitch didn't dissolve, and that's the part that's being like really painful. Other than that, I wasn't in pain, honestly. It was just like hard to like get up and stuff like that, but other than that, it wasn't as bad as I thought. Not at all. It really wasn't. So I believe I told y'all everything, because like I said, this is still fresh. I mean, I'm still healing. I will make sure I post some more pictures, each month, to show you guys how it's healing. Give you guys an update on my stitch problem, because right now I only see one, and I'm hoping it's only one, and they don't, because they said if it is one, which I actually can see it, so hopefully maybe they can just like pull it out. I don't know. I don't even want to think about that. But they said if it is like inside or there's any more or anything like that, they have to like numb the area and then make a small incision and take it out. So numbing the area, you gotta stick me with a needle while I'm up, because I've had that done to me before in the back of my head. That's another story we could talk about. But let me just say, I thought I was Tarzan. So, yeah. So, I'm probably have to go through that, and I know that's gonna hurt because my incision is still sensitive. So, yeah, lucky me. But I went over everything that I went through. Like I said, be careful with the Band-Aids you use. If you do use Band-Aids, I prefer the tape. Get the sensitive skin, because when you keep using the tape, your skin kind of gets irritated and it gets kind of like dry. So get one that says like for sensitive skin. That helps too. So yeah, make sure you wash your hands too before you clean your nipples and everything like that. Because of course you don't want them to get infected. I thought at one point mine was getting affected because I saw like pus or something. I thought I saw pus, but it wasn't. It was just me tripping out, me being extra cautious. Like, I want everything to go smoothly. And don't get me wrong, everything did go smoothly. Like I said, everything takes time. So you just gotta wait, just gotta work with it. And good luck to anybody that's getting top surgery. Yeah, I mean, that's it. So my next video, I will talk to you guys about hysterectomy. That was my recent surgery, so let y'all know about that. Y'all have a good day, and like and subscribe to my video, my channel. Show me some love. Alright, you guys, y'all have a good day.